1. A CVS shift supervisor is mentoring a new employee on pharmacy regulations. What is the most effective method for ensuring retention of compliance protocols? A. Providing a one-time written manual. B. Conducting role-play scenarios and immediate feedback. C. Assigning independent research tasks. D. Allowing the employee to observe without interaction. 2. A CVS team lead must evaluate a cashier's ability to manage high-volume customer interactions. Which method best ensures fair and accurate assessment? A. One-time quiz on company policy. B. Peer review from coworkers. C. Direct observation with rubric-based scoring. D. Customer satisfaction survey only. 3. In a training session for handling prescription requests, what instructional strategy best supports adult learners? A. Mandatory memorization of drug lists. B. Passive video viewing without quizzes. C. Scenario-based learning with peer discussion. D. Lecture with minimal interaction. 4. During a routine audit, a CVS store is cited for documentation errors. What adult learning technique would best address this with the team? A. Group brainstorming without direction. B. Disciplinary notices and memos. C. Hands-on simulation of proper documentation. D. Posting reminders on the bulletin board. 5. A CVS pharmacy manager is designing a mentorship program. What is the most important initial step? A. Selecting only senior employees as mentors. B. Creating a checklist of mentor responsibilities. C. Aligning mentorship goals with organizational values. D. Requiring monthly reporting forms. 6. Which of the following best reflects a formative evaluation method during CVS retail training? A. Final assessment test. B. Monthly store performance report. C. Mid-training knowledge checks and role-play feedback. D. Yearly employee performance appraisal. 7. A CVS assistant manager wants to reinforce customer service training. What method aligns with adult learning principles? A. Mandatory reading of customer policies. B. Interactive role-play followed by reflection. C. Watching a corporate video silently. D. Assigning end-of-week quizzes. 8. To ensure communication efficiency during shift changes, what strategy should CVS supervisors implement? A. Written logs only. B. Email follow-ups without feedback. C. Standardized verbal handoff protocols and feedback loops. D. Post-shift summary forms completed individually. 9. A CVS training coordinator notices disengagement during compliance training. What technique would increase engagement? A. Add more bullet points to slides. B. Incorporate real CVS case studies with group problem solving. C. Extend training duration. D. Assign a take-home reading pack. 10. Which of the following best supports regulatory compliance training for new CVS pharmacy techs? A. Weekly newsletter updates. B. Unsupervised e-learning. C. Interactive workshops with scenario assessments. D. Pop quizzes with no feedback. 11. A CVS trainer wants to ensure that employees apply inventory protocols correctly. Which evaluation strategy is most appropriate? A. Exit exam only. B. Anonymous survey. C. Skills demonstration with performance checklist. D. Peer review of accuracy logs. 12. What communication approach most effectively resolves interdepartmental conflict at a CVS store? A. Posting a policy memo. B. Group meeting with open dialogue and facilitator. C. Ignoring the issue until it escalates. D. Individual written statements. 13. A CVS team leader is introducing a new digital inventory system. What mentoring technique fosters long-term skill transfer? A. Encouraging trial and error. B. Providing daily check-ins and task modeling. C. Leaving the manual at the register. D. Assigning work without guidance. 14. A pharmacy employee fails to follow a new compliance policy. What adult learning principle should guide the corrective feedback? A. Use threats to ensure performance. B. Focus on why the rule matters and how to implement it. C. Publicly address the mistake. D. Emphasize rote memorization of the rule. 15. Which training method would best prepare CVS staff to de-escalate upset customers? A. Lecture on customer rights. B. Role-playing with feedback on emotional cues and phrases. C. Watching surveillance videos. D. Memorizing policy sections. 16. A CVS regional manager wants to evaluate store-level training effectiveness. Which metric offers the most actionable insight? A. Employee self-reported satisfaction. B. Test scores alone. C. Behavior changes and performance improvement post-training. D. Number of training sessions held. 17. To foster peer mentoring among pharmacy staff, what is the best first step? A. Offer bonuses for mentoring. B. Require all staff to participate equally. C. Identify peer leaders and provide facilitation skills training. D. Rotate mentors weekly without criteria. 18. A CVS trainer needs to adapt onboarding for different learning styles. What action best supports this? A. Delivering a single PowerPoint deck to all. B. Including visual, auditory, and kinesthetic activities. C. Offering only hands-on practice. D. Assigning homework without discussion. 19. What is the best way for a CVS supervisor to evaluate staff readiness for flu vaccination protocols? A. Staff verbal confirmation. B. Skills demonstration with live or simulated practice. C. Written quiz only. D. Attendance confirmation at training. 20. A CVS district manager notices variation in policy enforcement across stores. What is the best initial step? A. Issue blanket warnings. B. Provide a digital manual again. C. Conduct store visits and facilitate focus groups. D. Remove managerial discretion. 21. What communication strategy is most effective when rolling out new policy updates to CVS staff? A. Posting on break room boards. B. One-way email without response option. C. Team huddles with Q and hands-on explanation. D. Including updates in the next training cycle only. 22. A new CVS technician struggles with time management during busy hours. What mentoring approach is best? A. Assign more tasks to increase exposure. B. Encourage peer shadowing with feedback discussions. C. Let them learn by trial and error. D. Give a time management book. CVS assessment. The CVS assessment tests are a series of pre-employment evaluations designed to measure a candidate's suitability for various roles within CVS Health, including retail, pharmacy, and customer service positions. These assessments typically evaluate critical thinking, situational judgment, communication skills, attention to detail, and understanding of CVS's core values and compliance expectations. The tests may include personality questionnaires, math and logic problems, and interactive scenarios that simulate real workplace challenges. CVS uses these assessments to ensure that prospective employees demonstrate the competencies required to maintain high standards of service, adhere to regulations, and contribute effectively to a team-oriented healthcare environment. Here are the top 5 beneficial uses of the sample exam. 1. Improves hiring accuracy. CVS assessment tests help identify candidates with the right behavioral traits, cognitive skills, and values aligned with CVS Health's mission, leading to better job role fit and reduced turnover. 2. Evaluates job readiness. These assessments effectively measure essential skills like situational judgment, customer service, and regulatory understanding, ensuring applicants are well prepared for real workplace challenges. 3. Supports fair, data-driven decisions. Standardized testing creates a level playing field, allowing hiring managers to make unbiased decisions based on objective data rather than subjective impressions. 4. Strengthens compliance and safety culture. By screening for awareness of company policies and ethical standards, the tests reinforce a culture of regulatory compliance and safety awareness. 5. Identifies training needs early. Results can highlight developmental areas for new hires, enabling targeted onboarding and mentoring programs that accelerate performance.